Hi there, my name is Asif Rahman and I work as a doctor at a London accident and emergency department. In the department we see children and adults who come in with a variety of problems. One thing we do see is a lot of injuries resulting from fights, stabbings and the occasional shootings. The population that we see vary from young children to adults, but especially in the teenage age group we see quite a lot of these injuries which are related to some form of violence or fight. When the patient comes into A&E, they may be in a room like this, but often it's very noisy and there's lots of people running around. They may need some unpleasant procedures ranging from a small needle in their arm so they can have some bloods taken and we can give them painkillers, to having a tube put into their chest to help them breathe. Some of our sickest patients often will need to be put to sleep and will need to go to surgery, again, which can be quite a nerve-wracking experience. Often after surgery, people will need to be in hospital for a few days to recover and recuperate, and often that too is not a nice experience because they're in an environment that they're not used to. In the very sickest of our patients, they may need to stay in hospital for some time, and often after having surgery, they may need plaster cast, they may have scars. After getting home, some of our patients not only have some physical problems, but a lot of them will often have psychological problems. This may come in the form of flashbacks. They often might have to relive the event. They may not be sleep well, and they may have lots of problems about going out, and this may have an effect on them going back to school or going to see friends and going to see family. As well as family members being affected, often patients' schools and friends are often affected. We've had some children who have come in and they've had something not very nice happen to them. Their friends have heard, and this has had a huge effect on them. So it doesn't just affect the patient and their family, but it affects a wider group of people, including the communities that they live in. On a final note, most of our young people, after these injuries, do get home, and the whole experience is more of an eye-opener. A few of our patients do get home as well, but have long-term problems, both physical and psychological. But unfortunately, for a small group of our patients, they never get the chance to go home.